Uh, I hope everybody has joined in early, because otherwise a lot of questions are there pending and then I have no time to answer. So let us go forward. Yeah, so I was just doing a setting. Let us go forward and see. First, I'll see some questions and then maybe I'll get to the my case, what I've treated in my practice. Just today, I got a case where the patient had a symptom of severe headache, headache, and the pain was so much that there were other symptoms of headache also. But the important symptom now, whenever you're treating a case of headache, sometimes what happens, we try a patient of migraine comes, we take the whole case and then we start prescribing. But ask the patient during the attack of headache, during the pain of headache, what happens and what triggers his headache. That is very important. So this patient came to me. And he said, Doctor Sahab, I have severe headache. I have so much headache that I feel that I should hit somebody, I should throw something, XYZ. A lot of fearful symptoms were there. Yeah, good afternoon, Mishra ji. Lot of fearful, lot of anger symptoms was there. And I just asked the patient one more symptom. Why and how did you get such a severe headache? And he said, my son was giving an exam and he did not get good marks. I had given him everything what possible means I could do, but he still could not score good marks. And I was so angry. I shouted at him, and in the evening I started getting headache. That's why I've come to you immediately, because you have told me not to take any medicines for migraine. So what remedies come to your mind, anybody? What remedies come to your mind first, and then I'll discuss the remedy, what you have to see in this type of headaches. Anybody? We have a lot of doctors online every time, but if you answer, I also get to understand, I also get to know that you're understanding, and we can share our thoughts and we can help each other in our practice. So I gave the patient single dose of chamomilla 1 ml, 1 dose put in half cup of water, take that 1 spoon every 15 minutes, and I made the patient sit in my OPD. Believe me, after taking that 1 dose of that water, the patient was feeling better within 2 or 3 minutes. After that, when he went, he had no headache. So this is how you have to understand what does the patient do during that severe headache part, and how did the headache trigger. Suddenly, if there is a sudden headache, severe headache, then you have to have some sudden cause. Okay. One symptom of, sir, in one of your last live streams, you mentioned syphilis for cholinergic urticaria. Yeah, you can. Normally, whenever I prescribe a medicine, I start with only syphilis 1 dose, single dose, and then I'll see at the case. So, important symptoms of chamomilla. There's one symptom of chamomilla which is written that a chamomilla patient weeping and howling. Howling means shouting at the top of the voice. Howling. This is how a chamomilla patient will come and show you this symptom in your case. Howling. If you understand the meaning of howling, howl, to make long and loud sounds. So this is the weeping, and this is the personality of chamomilla. Weeping and howling. In fact, I had a case of depression where the patient said that I start weeping whenever I have sleepiness, because I want to do so much work, I want to do this, I want to do that, I want to go, I want to perform, but when I feel sleepy, I cannot do anything. So weeping with sleepiness, this is again a very, very important symptom of chamomilla. Of course, every time we have thought that chamomilla is very snappish, cannot return a civil answer, it is there. I am not denying that. But there are some symptoms of the remedy that you should understand apart from the normal symptoms which we take in our practice. chamomilla, especially if it's a child, just ask the child what does he do with the toys. The patient will say that my child, I get a new toy, and the toy is broken within 2 or 3 days because my child is so angry that he throws toys and he breaks the toys. That is also chamomilla. Okay. Hello Dr. Dhruv. अगर कोई दर्द वाजिश से हो रहा है तो क्या रूब्रिक बनेगा? कोई दर्द के वजह से रो रहा है. ओके. So Mishra ji, this is very very simple. We have a wonderful rubric, weeping with pain or weeping pain with. Simple. Problem कहाँ पे है? Where the problem come that weeping pain with, there are a lot of remedies. If I am not mistaken, there may be at least 15 to 20 remedies. Weeping with pain. We have coffea, we have Staphysagrea, we have Merxol also, we have Naxwamica, we have Platina. These all remedies have weeping with pain. How to antidote graphitis LM potency aggravation? First of all, Dr. Vishaka, if you give any remedy, LM or centesimal scale, my answer to this question is the next indicated remedy, the next similimum is as good as an antidote and a similimum to that case, whether it is an LM potency or a centesimal potency. I would not go in the books and read which drug follows well and do the antidote. I do not do this. Normally, I prescribe the next remedy, which is the closest similimum that would antidote the medicines which was taken before. Okay. So let us go forward. I hope this answers your question, Dr. Vish. This is what I do in my practice and I'm very happy and very successful doing this. Okay. So weeping with pain, Dr. Mishra ji. अब आते हम. One patient came to me and the patient came to my OPD crying. The patient had so much pain in the teeth that he was crying with the pain. And he said, sir, please see me early because there is so much noise. There was a lot of rush in my OPD. There was so much noise, the children shouting. This shouting also makes my teeth pain aggravated. This was the wording of the patient. Which remedy comes to your mind, my dear friends? I am asking you a question. The patient came to the OPD with lot of weeping. He told in the pain in the teeth with lot of weeping, and he told, please see me first because the children who are shouting in your clinic, that also aggravates my pain. Which remedy comes to your mind? Anybody? Which remedy comes to your mind? Yes? Anyone? Try to Theridion. Yes, this is right. So you have to think Theridion because see, this is how you interpret the symptoms. The Theridion, there is a penetrating pain. Simple weeping with pain in the teeth, there are 3-4 remedies. One would be Theridion, the second would be coffea, third would be sepia also. But this is important that because of the patient shouting in my clinic, the pain increases, that is Theridion. So homeopathy is so easy. Theridion treated that case. Teeth, hearing, shouting, yeah. Sina. No. If the patient is already having, Mishra ji, if there is pain in the teeth and that pain is aggravated because of the noise that penetrates in the teeth, the remedy is Theridion. Very well. You can think about coffee also. One patient came to me, the patient was in a lot of pain. He had just taken a gulp of water, of cold water, and his assistant came to me, sir, she has a lot of pain. Now she has put on a cold water in her mouth and the pain is better. Immediately I gave the patient coffea 1 ml in water dose and the pain was better. So this is how you have to see the symptoms and then interpret the symptom into remedy, the rubric form or the symptomatic form. Sometimes, the patient comes to you, there is weeping with menses. There is weeping with menses. There's a lot of pain, there's a lot of weeping with menses. And when the weeping starts, One remedy we always think about is pulsatilla. But my dear friends, think about two remedies which I have used very successful in my practice. First is Cactus grandiflorus and second is sickle core. First is Cactus grandiflorus and second is sickle core. So these are important tips which I have seen and I have used in my practice and I have got very good results. I think if I start explaining some cases, I will keep on explaining cases and I'll not be able to answer your questions. So you can always keep the question because it always scrolls up. So you can always keep asking the questions. No, weeping with menses is not pulsatilla. If you see mind weeping, so you have to cancel pulsatilla. One of my assistants is, I think, is writing the symptoms which I speak. So you have to cancel pulsatilla. It is only, I told, Cactus grandiflorus and sickle core. Okay. So let us go forward. Now forget the weeping part. Now we'll just move forward. I'll just add one thing in case of weeping. Is that I had a case where the patient was basically very diligent, very conscientious, very strong personality, never cried in life, very strong. But when that lady became pregnant, her first symptom was weeping, weeping, weeping. So I prescribed the patient. Of course, one or two remedies did not work. Then I went to that particular rubric, weeping during pregnancy. Believe me, I gave the patient single dose of mac carb because there was a lot of loneliness feeling in spite of having so many people around. So mac carb was given, and mac carb cured that case. So this is the beauty of homeopathy, a remedy which we think that is suited to the case sometimes does not work, and if you go to the rubric, go to the Mater Medica, that remedy works. एंग्विश, इंडिग्नेशन, इरिटेबिलिटी अगर किसी में हो तो सेटिस्फैक्शन के कमी है, इसलिए कौन सी रेमेडी? मिश्रा जी, सबसे पहले तो jealousy, feeling of being jealous, feeling of being envy, there is no treatment as such. There is no basically treatment for this complaints. But if you have asked me this question, I'll answer this question to you. I have a lot of cases, where the patient comes and tells us that he has got so much in life, I have got nothing in life, he has got so much in life. Keep comparing. So there is a lot of humiliation, there's a lot of comparison, there's a lot of mortification, other things. Remedy to calm the mind, very, very important. Normally, if you have these type of complaints, you have to take three remedies which I have used in my practice. First is sepia, second is silicea, third is sulfur. Only one case which I have which improved very well with one remedy, and that was Seneca. I cured that case. Everything calmed down. Not necessary that the humiliation, the mortification, the anger, the jealousy was taken care of, but everything was calmed down and the patient could live his life calmly. Of course, there were certain hurdles which were there, but he was much calmer, much happier with these medicines. Okay. Sir, high BP, vertigo, chest pain, please best homeopathy medicine. See, high BP, vertigo, 150 may if the patient is suffering from high BP and vertigo. First of all, I can't tell you the specific medicines used in this case, but in my experience, when I was using this remedy that has given me good results is Rauwolfia serpentina, Crataegus, Glonine, Spigelia. These remedies are very, very good. They have given me good results. Just to tell you, if it is associated with vertigo, then you can think about Nux vomica, Phosphorus, Digitalis, Natramine. Okay, but mother tincture wise, if you give Rauwolfia, temporary the BP would settle down. That will give you some breathing time for the constitutional medicine to work. Okay. Acidity problem for 40 plus. What will I tell you? It is 40 plus or 50 plus or 60 plus or 20 plus. Acidity is because of burning. Find out what is burning in the patient's mind, and then if you prescribe, you will get much better results. One remedy or two remedies for acidity that has very specific action on the acidity. The first remedy, think about Rubenia. Sorry. Think about Rubenia. It works wonderfully. You can give in mother tincture. It works better than antacids like omeprazole or Sumpraz or rabeprazole or pantoprazole, but only for a certain time. After that, you have to give the constitutional medicine. Second remedy you must think about is what I have seen in my practice, Iris versicularis. Third remedy that you can think about is China. All these remedies in low potencies or in LM potencies in repetition gives good results temporarily. Sir, your fans, your YouTube Sundar. Thank you so much. सर होम्योपैथिक से हाइपोथायराइड ठीक होता है क्या जड़ से? अनीशा शेख. आई थिंक आई हैव आंसर्ड दिस क्वेश्चन बिफोर ऑल्सो. होम्योपैथी से बिल्कुल हाइपोथायराइड इज क्योरेबल. You can ask my doctors who have worked with me. In fact, my German doctors who have worked with me in my clinic, I have shown them hypothyroid treated and cured with homeopathy medicines. It is definitely curable. Okay, so let us go forward. Yeah, I hope that answers your question, Dr. Anisha. So I have now there was one case, thanks. Okay, yeah, right. There was one case where I just reminded of that case of hypothyroidism. I'll just tell you one I'll just tell you one case. I had a case where the patient was hypothyroid, and a very interesting symptom in this case was that the urine of the patient was burning hot. Urine of the patient was burning hot, and the patient had only one problem, that she always felt that I should not have, I am in a position where I have a lot of status. My status should not fall, and she had burning of urination. I gave the patient borax. I started with 200, then 1 potency, then LM potency. I treated and cured the hypothyroid case with borax, with these two symptoms. Of course, the case was very long, but this was my repetitive symptom. Urine was hot. Okay. Talkative loquacity continuously है तो lactasis fail, क्या remedy? Okay. See, there is one rubric, talk desires to. Means if you ask this patient, he will say, Doctor Sahab, I want somebody so that I can talk. Loquacity may be not every time suitable for the case, but desires to talk to someone. कोई ना कोई चाहिए बात करने के. I want somebody to talk. You must think about argentum nitricum, argentum metallicum, and one remedy which is very rare, but that remedy has given me fantastic cure, with desire to talk to someone, and that remedy is Sticta pulmonale. That remedy is Sticta pulmonale, my dear friend. Sticta pulmonale has one symptom apart from this, which is very, very important. And that is, the patient says, I want to talk, whether the person is listening to me or is not listening to me. मतलब वो आदमी मेरा सुनेगा या नहीं सुनेगा. The person has to be with me. I'll keep talking. It does not matter whether the person listens to me or the person does not listen to me. The only remedy in the whole Materia Medica is Sticta pulmonale. मिश्रा जी, मजा आया कि नहीं रेमेडी में? बहुत रेयर रेमेडी बताया और बहुत इंपॉर्टेंट सिम्टम बताया है. वेरी इंपॉर्टेंट सिम्टम आई एम टेलिंग यू. सर, आपका हॉस्पिटल पुणे में है क्या? नो, माय हॉस्पिटल इज नॉट इन पुणे. आई प्रैक्टिस इन नागपुर एंड बॉम्बे. Okay, Yeah, so my assistant has answered the question. This is stricta pulmonale. Okay. So let us go forward. Dr. मिश्रा जी आपको समझा कि नहीं? I hope you understood this. Talks desires to someone, very important and very interesting symptom, Doctor. Good evening, Dr. Husna. So let us go forward. Yesterday morning, I think yesterday evening, I had a case of lichen planus. Very bad lichen planus. The patient was from Dubai. She had stayed in Germany, then shifted to Dubai. Lichen planus, very blunt, very blunt in talking, very dictatorial, very rude in talking. I prescribed the patient one dose of a single dose of the remedy. Today morning, she did me WhatsApp. Her cousin who had come to me did me a WhatsApp. Sir, after taking your first dose, in 10 minutes, she immediately went to sleep. And she woke up in the morning very fresh, but there is a lot of itching in the lichen planus, which was not there. Within 10 minutes of the perfect simillimum. That is the beauty of homeopathy. Okay, I will tell you the remedy when I cure that case. Okay, sir, Bombay में कहाँ है आपका clinic? You can WhatsApp your number. I'll send you the address. Okay. So this was the beauty of homeopathy. Within 10 minutes, a case of lichen planus has got the result. Of course, at the level of mind, and itching now in the affected area. So when I cure that case, I'll put up the case, which remedy I have given and how I took the remedy for prescription. Just by her talking. Her age is, I think, 21 years of age. Okay. So let us go forward. I think some questions have scrolled up. Just one question, sir. Raulfia BP books regarding good or not good, sir. No, Raulfia is a good remedy. You can prescribe Dr. Sumathi. It's a good remedy. It will definitely work. At least it will give you some breathing time so that you can take the case and then prescribe the potentized medicine. Okay. So let us go forward. I hope most of the questions are asked. Now we have lot of rains here. Rains have started, and you will have lot of cases of cough, cold, coryza. So I'll just have some acute cases of cough which I have treated. There was a very interesting case of cough, very interesting case of cough. And the patient came to me that, sir, I have constant cough. I just cannot stop coughing. And I asked the modality. She said, sir, every time I am coughing only. Now also sitting outside the chamber, I was coughing. When I sit down, I cough. When I lie down, I cough. In fact, I cannot sleep also because of cough. Which remedy comes to your mind? Anybody? Which remedy I must have given the patient? The patient took the medicine in the evening. She came to the clinic. In the morning, she was better. Anybody? Which remedy comes to your mind? Sometimes the remedies are very easy, I always try to give you some easy symptoms and easy remedies so that you are able to prescribe easily. The patient says that no modality of cough. I stand, there is coughing, lying, there is coughing, everything. The cough is so much, Dr. Saab, that I cannot sleep also because of the cough. That is what the patient wanted to tell. So what remedy comes to your mind? Anybody? If my doctors are seeing who are working with me, I think they should be able to tell this remedy. So I prescribed a single dose again of stricta pulmonale. Stricta pulmonale has a very important symptom. Constant cough preventing sleep. In fact, the only remedy is stricta pulmonale. I told you the importance of talking. The stricta patient wants to talk, whether the person listens or the person does not listen. This also coughs so much it prevents sleep. That is also stricta pulmonale. So my dear friends, I hope you enjoyed. We have still 5 minutes left. I am not shutting it down. So let us go forward. Hello, are you with me? Just write down something that you're understanding, that some thumbs up or some emoji, so that I know that you're understanding. Otherwise, I feel that I'm talking to the computer every time. So one of my assistant has come inside and there is no question. There is a question on lipoma. I have not received the question, Dr. Usna. She has a question on lipoma, but I have not received that question. Okay. The last question, which is that, sir, if there is a clinic in Bombay, are you listening? Are you with me? Are you getting what I want to tell you? So, second type of cough. Now, this patient came to me and the cough was as if that drums were beating. The cough was very deep sounding cough. And the patient came to me. Now, whenever the cough is deep sounding, the patient will come and tell you it feels as if tabla baja hai, drum, dhum, 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 deep sounding cough. So, two remedies you have to remember. The first is stramonium and the second is verbascum, my dear friends. First is, are you with me? Are you understanding what I want to tell you? Because one question has come on the WhatsApp and Skype. Okay. I think I cannot see your writing. Okay, I have the answers. Rumex was there, Drosera was there, Coccus cacti was there. No, I prescribed the patient. The answers are on the WhatsApp, So I prescribed the patient Sticta pulmonale. So I think something is wrong in this. I cannot understand why I cannot see your answers. Okay, so let us go forward. Yeah, so I'll just complete that. So whenever there's a deep sounding cough, you have to think about stramonium and verbascum. There was one cough, I cannot see any questions here. There is one question here. Yeah, Dr. Husna. 42 years old, male patient having lipoma all over the body. Type of lipoma, soft, movable, size increasing, feel pain when touched. He diagnosed with cholesterol. Father passed due to lung cancer. Okay. So if this is the case from Dr. Husna. So Husna, first of all, sorry I could not see the question on the YouTube. If the patient has developed lipoma after the death of the father, then you can directly take the rubric after ascertaining what was the condition or mental condition of the patient because of the death of the father first. Second, lipoma. There are some medicines which I have already told before for lipoma. Of course, if you ask me, I also find it very difficult to treat lipoma, though I have cases where I have been successfully able to treat that case. The first remedy that you should think for lipoma is thiosinamine. I always use thiosinamine in LM potency. Repetition twice a day. One is over, then LM2, then LM3, then LM4. With that, I have found that lipoma is taken care of. It reduces in size, but it's always gradual. The second remedy, which basically I use in my practice, is lapis alba. Lapis alba is the remedy which I use depending on the symptoms XYZ. Third remedy which I use in my practice, if it is painful on touch, think about phytolacca. The fourth remedy you must think about when there is lipoma and accumulation of fat, think about, there's one remedy which I use is calcarea carb. Again, these remedies basically if possible, use in LM potency, which will good results. Now, you have told me that if it is because of the death of the father, it does not matter that it passed through the lung disease. Death of the father, then you have to think of the remedy like ignitia, natromur, ambra grezia, lycopodium. And if it is because of cholesterol, you are telling me that's because of the cholesterol, then 3-4 remedies very, very important. The first remedy is cholestrinum. Think about cholestrinum. Think about one rare remedy which I use in my practice if it is because of high cholesterol, and that is methionine, 30 potency. This I use in my practice. Okay. So sorry, I had to answer the WhatsApp was sent by my assistant doctors. I could not see what's happening in the YouTube. So it's already half an hour up, and thank you for joining. I hope you enjoyed as much as I enjoy sharing my knowledge with you. Thank you. Until next Saturday. Bye.